We're here today with Andrea Chronis-Toscano, who's doing some really path-breaking work about mothers of kids with ADHD who also have ADHD. It's really a privilege to talk with you today. I'm Katherine Ellison. I'm an author and journalist and read a lot about ADHD. Where are we talking to you from?
I'm in Maryland, just outside of Washington, D.C.
Can you tell us about the study that you're conducting there? It's in its fifth year, is it?
Yes, correct. We are screening for parental ADHD in pediatric primary care with our partners at Children's National Medical Center. The reason why we're doing this is because we know that 80% of parents with ADHD have at least one child with ADHD. When parents have ADHD, it makes all of those tasks of parenting even more challenging to provide external structure and consistency and scaffolding for your child with ADHD if you struggle with some of those same executive functioning difficulties. For years, we've tried to develop and test ways to support parents who have children with ADHD and they're also struggling with ADHD.
That's fantastic.
The intention is to develop a sustainable treatment model that will last after the NIH grant is over. One of the things that we learned right away is that just simply handing out a screener when you get that clipboard or the iPad at the doctor's office could be off-putting for some families. They might be wondering why, if I'm taking my child to the pediatrician, am I filling out something about my mental health? And then many parents have concerns about their children getting labeled with ADHD, and that requires careful conversations to help parents understand that could help their child academically and socially. We stay away from labels and just describe the problems that children are having, like attention difficulties or executive functioning difficulties. There are also lots of parents hesitant around medication.
Right. Being the parents.
Yes, we're medicating the parents. We try to provide the optimal early environment for the children to be successful. We are trying to set up the parents for success. When you participate in a parenting program to learn evidence-based parenting skills, if you have ADHD yourself, you might not remember to use those strategies. When it comes to interacting with their kids, parents might say, oh gosh, I just fell back into old patterns. I forgot to use the strategies. If we could help parents through a combination of medication for the parents and teaching them parenting skills alongside cognitive, behavioral, and organizational skills that will help them with their ADHD, they'll be in a better place to then help their child. We're not blaming parents. We're not suggesting that any of the difficulties that their children have are their fault, but rather that we are there to support them. We can't ignore that they're struggling with the same types of difficulties and that they can't provide that external structure and consistent environment for their child until we can help them for their ADHD.
I just wondered if it's too overwhelming for them to learn about their own diagnosis at the same time they're learning about their child's diagnosis. How well are they able to move forward?
Some of the parents have already been diagnosed with ADHD, and others are just being evaluated for the first time. Sometimes when we are evaluating children for ADHD, they recognize that they experience the same things. As a colleague of mine and I are now trying to do similar work in OBGYN offices with expectant moms. So if we could help expectant moms with ADHD develop tools to manage their ADHD, if they could learn those skills before they have kids, then we would continue to work with them for a few months as they ease into their new role, which of course involves a lot of executive functioning. That's something that we're hoping to do in the near future. But for treating parents with ADHD and their children, we are systematically testing if we medicate mom or dad prior to teaching them the skills, if they pick up those skills better, practice those skills more often, etc.
That's pretty fantastic in this main study. How old will their children be?
The children can be anywhere between 3 and 8. We started out wanting younger kids because the American Academy of Pediatrics suggests that behavioral interventions be tried before medication in children age 6 and younger. We wanted to intervene before the child is on medication, but then the pandemic hit. We had to widen our age range.
I've seen research that seems to suggest that kids with ADHD end up being abused or mistreated more than other kids. Are you finding any indication that this is having an effect on that?
We haven't looked at that yet in this study, but Steve Hinshaw, my colleague over at Berkeley, has shown that girls with ADHD who have experienced trauma have far worse outcomes than girls who have not. We know that children with ADHD sometimes pull more negative reactions from their parents and teachers and peers, that bidirectional influence of people getting frustrated with them, and then they respond in a way that actually makes the problem worse. That is a cycle that we see in general. The kids that we've been seeing in this study who are living in underserved areas, there's a lot more trauma in the parents. The kids have been exposed to more. It does make it much more complicated. Many of our ADHD treatments haven't really been studied with anyone other than middle to upper middle class white boys. A new study actually just came out by Melissa Danielson at the Center for Disease Control, showing that now the prevalence rate of ADHD is 11%. We actually wrote a commentary on that article for the same journal. If you look at the disparities, they're huge in terms of who gets a diagnosis and who doesn't, and who receives evidence-based treatment and who doesn't. Children from Latinx families and from Asian American families are much less likely to get diagnosed and treated.
That's really interesting. I'm wondering if you get pushback from parents.
The research has shown that dads often see less impairment in their children than moms do. The parent that places the most demands on the child who has more parenting responsibilities is usually the one that gets the most pushback. Right.
And have you found a good way to deal with that?
We've learned that taking the time to listen and to ask about the concerns, what a diagnosis of ADHD means to them. Are they afraid about how the school system will perceive them? What are their fears? What are their concerns? Being able to talk through that is really important.
I'm very intrigued by how you see this extending to normal practice after your study ends.
We're working in pediatrics. I think that family practice might actually be an even better setting because family practice docs are used to treating both parents and kids. Many pediatricians don't have the capacity to treat parents. They're not board certified in adult medicine. When we published our first paper on this topic, I think it was in about 2003, we really tried to get the message out. If you're treating a child with ADHD, chances are one of their parents may have it too. When you go to the doctor, usually you fill out some paperwork saying who in your family has these problems because it places you at higher risk. To the extent that we can do that with mental health as well, that would be wonderful. For mothers immediately postpartum, it is rolled into those early pediatrician visits and OB visits that they're getting a depression screener. We know about the risks of postpartum depression. Getting our medical providers and nurse practitioners, et cetera, comfortable with asking about parent mental health, or even saying, does anyone else in your family struggle with these same kinds of things?
A lot of people, as I'm sure you've heard, say ADHD is being overdiagnosed. Why
Right.
would it be as important a problem as postpartum depression so that you would want to fit it into a mother's postpartum screening?
Many of the adult women who are depressed have a history of ADHD. A study that we published in 2010 showed that almost 20% of the kids diagnosed with ADHD during the preschool years made at least one suicide attempt before age 18. Even though people think of ADHD as maybe not that severe, the consequences can be really serious. We're talking about things like substance abuse, suicide, a life expectancy duration of 10 to 15 years less than people without ADHD. We need to be focusing on identifying, treating. Is it overdiagnosed? Maybe in some places, but in other places, there are kids who are completely being missed. Those tend to be kids from underrepresented backgrounds, lower income, non-English speaking parents. They're really not getting the help that they need to be successful. One of the great things about ADHD is that we have evidence-based treatments. It's just a matter of getting those treatments to the people that need the treatments. We know those treatments don't work as well when parents have ADHD, which is why you need to assess and treat the parents as well.
What could make a difference in how parents treat their kids with ADHD?
There are two main buckets of parenting skills that we have. All the executive functioning aspects of parenting, right? The planning, the filling out forms, the making the doctor's appointments, the remembering to give them their medications, to take them to the dentist, those kinds of things. On a day-to-day basis, that also means planning in terms of packing the lunches, getting everybody up on time, making sure that the backpacks are packed, that the homework is done, that you have a consistent bedtime, right? Things like that require a lot of executive functioning. Things don't always go the way they're supposed to go, right? So we need to problem solve and figure things out. Those executive functioning aspects of parenting. And then there are the emotion regulation aspects of parenting. If your child does something that is really frustrating or upsetting to you, how do you respond to that? Can you inhibit those negative reactions in favor of some of these new skills that you're learning in therapy? Those are the two main ways that ADHD and a parent can play out their parenting. We know that kids with ADHD do best with structure, routines, right? Consistency. Figuring out how we can best support parents, making that daily schedule, sticking to it, using a calendar, having the little alarms go off on their phone when they need to be somewhere, when they need to leave to go somewhere, or making sure that they're doing as much as they can the night before so that it won't be chaos in the morning. There's so many ways that we could help parents. The trick with ADHD is, how do you help them to actually use the skills on a consistent basis and not just fall off using the skills?
It could have an intergenerational effect, obviously, if you're modeling good parenting for your kids and modeling how to survive with ADHD. It can last for generations. So, what is the next step in your research?
We want to figure out what you were saying about implementation. How do we get these things to stick? We are very interested in family navigation models, which have been used with many other chronic health conditions, where families are assigned to a navigator who help them lay out and get the services that they need for their child. That could really be helpful in terms of that overwhelm. Probably every family we work with, when a child gets an ADHD diagnosis, could really benefit from having someone to help guide them through the IEP process or getting therapy and what the different medication options are. And if the parent thinks that they might have it too, well, how do they find someone? How to do that? And then if you add on to that socioeconomic disadvantage and needing to also apply for assistance with housing or food insecurity, and that really compounds things. All of these applications require a lot of persistence and multiple steps. That's really what can trip up families with ADHD. The other thing is working with parents from diverse backgrounds to talk about their experience with, if they have a child that is displaying some symptoms, what are their hesitations about getting a diagnosis? There are different testimonials they can hear from people who might say that it was really tough getting my child diagnosed, but we got all this help and now my child is really successful. To give them hope. The wonderful thing about ADHD is that we do have such wonderful treatments, such effective treatments. The question now is really reaching the people that aren't accessing care. We need to think about how we can expand our workforce, diversify our workforce. There's a lot of work to be done for sure.
I can imagine like having a navigator inside the school. It seems like a worthwhile use of money. So many parents are reinventing the wheel and they're having to be their own navigator. And like you say, with ADHD, that's a tall order.
Yeah, I think the other thing is that now there's also so much information available to us on the internet. And
yeah, like
it's overwhelming.
Yeah.
Parents don't know how to sort through what is evidence-based. What should I be listening to? What are my trusted sources? The vast majority of what's out there is not evidence-based. So how do we help parents to sift through all of that?
Do you have any ideas?
When we work with families, we will often give them a list of, here are some places you could go for really good information. But those are parents that have already made their way to us.
What are the best evidence-based strategies for ADHD?
Our best evidence-based strategies for ADHD are behavioral interventions delivered at home and at schools, behavioral parenting interventions, working with parents to structure the environment in a way that will help the child be most successful, and then doing the same kinds of things at school, setting really clear expectations, praising the child for any successes, and non-physical consequences for misbehaviors, and organizational skills trainings, how to organize your backpack or your bedroom, keeping to-do lists, right? And prioritizing things that are on those to-do lists, using a calendar system to keep track of what we have to do at different times and setting those reminders, figuring out how to prioritize, right? The rocks, pebbles, and sand analogy from long ago about making sure that you're prioritizing what's most important, spending your time doing those things, and then letting the less important things or the pebbles in the sand come later. Otherwise, your jar will just be filled with less important things. A schedule.
I hope you're also talking about exercise.
Yes.
Oh,
absolutely.
Yeah.
Absolutely. Exercise. One of the reasons why adults with ADHD are more likely to die earlier is because of less exercise, more obesity, fewer positive health behaviors, high cholesterol, heart disease.
Medicating with Twinkies.
Yeah, exactly. In addition to accidents and substance use and suicide. So it is really important to teach healthy habits and sleep. Sleep is a huge one. If we don't get enough sleep, our mood is not great. Our executive functioning is worse. If you're a parent with ADHD, your patience for your child is going to be much lower if you're not getting enough sleep. The parents that we work need to have a primary care physician established Many of them don't go for their annual checkups. They might not be taking vitamins, exercising, all of those things. But I think that could be better studied. I think that the awareness around ADHD running in families, I feel like that's out there now. You see much more in terms talk about it. If your child has ADHD, you might have it too.
Well, that's still the thing with the inattentive is some parents say, oh, my son got diagnosed and I didn't recognize it in my daughter. So that awareness that it presents in different ways and we have to be watching for it in these different ways. Our organization is really concerned to get the children diagnosed before they turn 8. There's no reason it needs to be delayed till adulthood.
What we see is that sometimes for individuals who are really bright, you don't start to see the impairment until they enter middle school or until they enter high school, and the demands are higher. That's when you see those executive functioning difficulties shining through because they were able to get by before.
I'm wondering if we put too much emphasis on they were doing well academically. If we looked with a broader focus, you would see that they had areas in their life where they weren't doing well or they were masking.
Correct. Sometimes it's social rejection, right? Or being so anxious because they're trying to hold it all together and to hide what they're struggling with. You're absolutely right. That type of education for parents, pediatricians, educators.
Not just putting the focus on he's doing well in school. It's got to be a broader look.
Correct. Sure. Yeah, that's a great point.
Yeah.
Thank you. I'm so glad to meet you. I've read your name so many times. And now to learn about your work, it's exactly what I'm hoping comes into the world. And to focus on women during pregnancy is awesome because they'll have time. They'll still be busy, but they have time to inculcate that knowledge. I have ADHD and they have time to develop themselves before they have to take on their child that might have ADHD.
We feel that's so important because once you establish patterns of parenting, it's much harder to undo those. With tools, one with ADHD can do great things and be happy. We want to encourage the teaching and the consistency with those skills from as early as possible to help people with ADHD lead better lives, happier lives.
What inspired you, Andrea, to do this particular work?
I fell into it. Becoming interested in parents with ADHD was a function of working with kids with ADHD and seeing how challenging it was for these parents to do the kinds of things that we were trying to help them to do. Not for lack of wanting, right? They wanted to do anything they could to help their children, but struggled. How could you help to structure your child's homework time if you have trouble creating structure for yourself, if you have trouble organizing a complex homework task? One of my first patients was a child where the psychiatrist said the medication just isn't working for him. I was talking to mom, they forgot to take it most days. Helping to get a system in place just to remember to take the medication really made a huge difference for him. There's so many examples of how difficulties related to parent ADHD make it challenging to deliver treatments for children with ADHD. The best feeling is when we get feedback from families who said, this changed my life. I finally felt understood. I finally feel like I can help my child. That makes it all worth it.
That's so great to hear.
Yeah, thank you so much.
Of course.
Yeah, bring your message to a lot more people. Yeah.
I hope so. I look forward to it. Let's stay in touch for sure.
Yeah, definitely.
We believe all girls with ADHD should get a fair start in life by getting diagnosed by age 8. Visit us at www.findtheadhdgirls.org. Thank you.